Hi, I'm Emily. I'm going to be your student nurse today. I'm just going to perform hand hygiene and pull the curtain. If you could just state your name and date of birth for me. Okay. And do you have any allergies that I should be aware of? All right. I'm just going to check your abdomen first, and then we're going to place a nasogastric tube. I'm just going to pull your covers down, provide you privacy. I don't see any lesions or scarring or any signs of distension, so I'm just going to take a listen.
Measure the tubing, so I'm going to go ahead and actually move this basin for the moment. So you'll measure from the nose to the ear.
So today I'm going to.
And that's going to be when the tube is in the pharynx. And then from here.
I hear bowel sounds present in all 4 quadrants, and then I'm just going to percuss.
So it's just about right here. So I'm going to go ahead and either mark that with a surgical marker or tape. For this video, I'm going to go ahead and just use some tape.
Okay. And now I'm just going to palpate. Just let me know if you feel any pain.
And then I'm going to also, again, just go ahead.
All right, we're going to go ahead and put in the nasogastric tube as ordered. And I'm just going to set you up.
When to reposition the patient. I'm going to go ahead and put this back here. All right, let's go ahead and just take this tip.
Hold that. Wait.
So we'll lubricate the tip. Very slowly. Down,
Okay, and while I'm getting everything set up, if you could just put your finger over one nostril and sniff, and then do the same for the other, that way we can figure out which nostril will be best to use. So I'm just going to open this.
And for our lab, our
on my
tubes that actually reach the
gloves.
stomach, so normally I keep inserting.
This procedure may be a little uncomfortable at first, but it will feel much better after it is over. And we're also going to be administering a feeding if everything works out okay with the procedure, so just be prepared for that. I've got a basin with a pH strip in it, my tubing. I'm going to put a blue pad on the patient in case there's any
So just kind of a
thing that
temporary
spills or comes out. Also,
securement.
I'm giving the patient a basin if they need to spit or feel like they're going to throw up. I'd also give them tissues to wipe their mouth if they need to.
So I'm going to go ahead and take my
Okay, and the patient has stated that their right nostril is the one they want to use, so that's what we'll do first. I'm going to measure from the nose to the ear down to the xiphoid process. It's just going to be about right here, and I would tape this or mark it with a pen or marker, but I'm just going to hold it for now. And I'm going to ask the patient to push their head back against the pillow and lift their head up until we get to the pharynx, and then once we reach that point, I will have them take a sip of water and have them tilt their head down. And I would also lubricate the tip of the tube, but since this is a mannequin, we're not going to do that. So
it's really
go ahead and
necessary to
insert
have a beaker or something next to you to go ahead and measure that amount in its entirety. So you go ahead and
Okay, and we've reached the pharynx, so I'm just going to have them take a sip of water and then bear their head down until we reach the stomach.
And then you're going to assess to see exactly how many milliliters of
And once that mark is reached, I'm just going to tape the tube in place to hold it while I check to make sure that it did reach the stomach.
While I prepare the.
Just going to tape that to the cheek.
I'm going to
Just very loosely, just to hold it in place. And now I will check for the placement of the tubing. So I'm going to
and you want to make sure that when you're administering the feeding,
place a syringe on and just pull out a bit of aspirate,
and I already have all of
unattach.
That way you can see how
my
well the
pH
patient
strip
tolerates it before proceeding.
and just place
And
a
actually,
slight
before I do
amount.
this, I want to go ahead and put more security
Okay.
on
The pH reads
tube,
that
so
it
go ahead and
is
tape over that
below
again.
5.5, which means
sure
we
it's
are in the
secure.
stomach, and
So-
the aspirate is greenish yellow with a little bit of floating food inside, so I do know that we are in the stomach. So I'm going to go ahead and just push the rest of the aspirate back in. And then I'm actually going to pull all of the stomach acids out and contents out, just to make sure that they do not have an overload of fluid in their stomach right now, so that we can proceed with the feeding. So I'm just going to pull that out. Okay, and it is, it's not too much. It does work for the feeding, and it's regulated with the facility amount that they can have before feeding. So I'm just going to push that back in, and then I'll be irrigating the tube before the feeding.
Tip into the syringe.
Take this
and
off.
then you're going to go ahead and
Pull this
re-irrigate
out.
with 30
I'm going to take
60
sterile water,
of water.
pour 30 milliliters in, and I will just
They tolerated everything.
push that back and reattach.
So we're gonna go ahead
And push
reverse.
all
And then
of
based on
the
others, we might either be assigned to leave the
water
tubing in the
into the
patient,
tube.
For the next feeding.
And then we will be
that means you
done
could
with
go ahead and
this
secure the tube
syringe,
into
and
the
I'll also
patient's
take
gown.
off these
If
gloves,
you
and I would
reverse
kink
remove
or
it, you do so as following.
cap the tube during this
So I would
time,
just,
so the
pin this up on the
contents does not
patient.
flow out. So I'll get rid of these gloves, and I'll place new
And
gloves
make sure I put
on.
an actual clamp on there so nothing seeps out.
And then from the nostril down to.
And then something I forgot to do was measure the tube.
I should be inserting it, which is about 45
That's like the
centimeters.
part of
I
the
also
tubing
would
that's
have
on
measured
the
the tube
So
length from
I'll pretend
the
this is
placement
part
in the
that's in
nose
the
down
base
to the xiphoid process, just to be sure that the tube did not move, and I would document that finding. We also would have had an x-ray
And so we've got
to
about
confirm the
78
placement of the
centimeters
tube
tubing
before
left over.
continuing. So
I would
now
go
I
ahead
will
and
take,
pin
or
and
actually I will
secure
tape the tube in place, since we do know that it is in the stomach.
Clean up my supplies.
Have the patient press their tube.
And then I perform oral care as needed, and then I can go ahead
Just
and
gonna tape this
remove
in
my
place.
gloves,
Or to drink and
and then perform hand hygiene, and ask the patient if he needs anything else before I leave.
inserting it, and I would make sure that,
Did you do it?
only insert it
Yeah.
after.
The only reason I
swallowing,
laughed
and making
is
sure
because
to
you
take right.
So that is placed on the nose.
If they're
But it's
on,
okay.
get
All right,
that out.
and we
I
would
don't
get
think we'll be able to see
the
that far in the video.
syringe, and we would take the plunger out,
And so this point,
and I would take the feeding, and I would check the expiration date and make sure that it is compatible with the tubing, or with the patient to be feeding. And then I would pour in 70 milliliters into the tube, and I would actually connect it first, and I would hold this up so that the contents would flow. And when it is almost empty, I would take 30 milliliters of water, and I would pour this in and let that also flow, just to get the remaining food out, and irrigate the tube. And then I would unclip the tube, or unclip the syringe and get rid of it. I would cap this tube and attach it to the patient's gown, and I would make sure that they were in no discomfort and that there wasn't any
We'll just say everything.
complications with the feeding, and we would be checking back with them every 4 to 6 hours, and be sure to check the placement of tubing before each feeding. And then I would just go ahead and clean up
Insert it to clean the tubing.
and make sure the patient didn't need anything.
Inserted, I